Hello and welcome. Today we're going to tackle an important topic that can cause a lot of worry but isn't often talked about openly: vaginal lumps and bumps. If you've noticed an unusual bump in your vaginal area, you might be feeling anxious or unsure about what's going on. Don't worry, we're here to clear up the mystery. In this episode, we'll explore the different causes of vaginal lumps and bumps, how to identify them, and most importantly, how they can be treated. We'll also answer frequently asked questions, so you can feel confident about your body and know when it's time to see a healthcare provider. Let's dive in. If you find this information helpful, please like, share, and subscribe to our channel for more health tips and advice. Let's get started. Let's start with what can cause lumps and bumps in the vaginal area. While some of these are completely harmless, others might need medical attention. Here are the most common causes. 1. Cysts, Bartholin's cysts. These form when the Bartholin glands, which are located on either side of the vaginal opening, become blocked. They can result in a painless lump, though if infected, they may become swollen and painful, causing an abscess. Sebaceous cysts. These are small, harmless lumps that can appear under the skin when sebaceous glands or oil glands get blocked. They are usually painless and do not require treatment unless they become infected. 2. Ingrown hairs. If you shave or wax your pubic hair, you've probably encountered this at some point. Ingrown hairs occur when the hair curls back into the skin instead of growing out, leading to small, red, and sometimes painful bumps. These can sometimes be confused with pimples or even more serious conditions, but they usually resolve on their own. 3. Genital warts. Genital warts are caused by the Human Papillomavirus, or HPV. They often appear as small, flesh-colored bumps that can sometimes cluster together and look like cauliflower. These warts can cause discomfort and itching, but they are treatable. 4. Skin tags. As we discussed before, skin tags are small, benign growths that can appear around the vagina due to friction or hormonal changes. These lumps are soft and typically painless, but they can be removed if they cause discomfort or irritation. 5. Molluscum contagiosum. This is a viral infection that causes small, raised, pearly, or flesh-colored bumps. It's contagious and can spread through skin-to-skin contact, including sexual contact. These bumps are usually painless, but may itch or become irritated. 6. Herpes. Herpes sores start as small red bumps that can turn into blisters, which may eventually burst and form painful ulcers. Caused by the herpes simplex virus, or HSV, these sores tend to come and go and can be accompanied by flu-like symptoms during the first outbreak. If you suspect herpes, it's important to see a healthcare provider for diagnosis and treatment. 7. Vaginal varicose veins. These are swollen veins that can appear around the vulva, especially during pregnancy. While they may look concerning, they're generally harmless and often disappear after giving birth. However, they can cause discomfort and pressure. Now that we've covered the causes, let's talk about how to identify what type of lump or bump you might have. Here's a guide for identifying common vaginal lumps and bumps. Bartholin cyst. Feels like a soft lump near the vaginal opening. If infected, it may be tender and filled with pus. Ingrown hair. A small, red, and sometimes painful bump, especially in areas that are shaved or waxed. Genital warts. Small, flesh-colored or gray bumps that may cluster together. Typically painless, but they can itch. Skin tag. Soft, hanging piece of skin that is flesh-colored and usually painless. Herpes sores. Red bumps that turn into painful blisters or ulcers. Molluscum contagiosum. Smooth, dome-shaped bumps with a dimpled center. If you're unsure, the best way to identify the cause of a lump or bump is to see a healthcare professional for a proper diagnosis. They may perform a physical exam and, if needed, order additional tests to rule out infections or other conditions. The good news is that most vaginal lumps and bumps are treatable. Let's break down the treatment options. 1. Bartholin cysts. If a Bartholin cyst isn't causing pain, you may not need any treatment. However, if the cyst becomes infected and forms an abscess, it can be drained by a healthcare provider. In some cases, A small catheter may be inserted to prevent recurrence. 2. Ingrown hairs. Mild ingrown hairs usually resolve on their own. You can apply a warm compress to soothe the area and avoid picking or squeezing the bump. Exfoliating the skin regularly and avoiding tight clothing can help prevent future ingrown hairs. 3. Genital warts. While there is no cure for HPV, genital warts can be treated with prescription medications, freezing, cryotherapy, or minor surgical removal. Always consult a healthcare provider for the best course of action. 4. Skin tags. Skin tags don't need to be treated unless they cause discomfort. A healthcare provider can remove them using cryotherapy, excision, or cauterization. 5. Molluscum contagiosum. This infection often clears up on its own, but if the bumps persist or spread, your doctor may remove them using cryotherapy, curettage, or topical treatments. 6. Herpes. Herpes is a lifelong condition, but antiviral medications can help manage outbreaks and reduce the risk of spreading the virus to others. If you suspect you have herpes, see a doctor for diagnosis and treatment. 7. Vaginal varicose veins. These typically resolve after childbirth. Wearing supportive underwear and avoiding long periods of standing can help alleviate discomfort. Now let's move on to some frequently asked questions about vaginal lumps and bumps. These are common concerns, and we're here to answer them. Question 1. Can vaginal lumps be a sign of cancer? While it's rare, some lumps can be cancerous, such as those associated with vulvar cancer. However, most vaginal lumps are benign and non-cancerous. If you notice a lump that is changing in size, color, or texture, or if it's painful and persistent, it's important to see a healthcare provider for evaluation. Question 2. Should I be worried if I find a bump near my vagina? In most cases, bumps near the vagina are harmless, such as ingrown hairs, cysts, or skin tags. However, it's always a good idea to get any new or unusual bumps checked out, especially if they're painful, growing, or not going away on their own. Question 3. Can I pop an ingrown hair or cyst? No, you should avoid popping or squeezing any lump near the vaginal area. This can lead to infection or scarring. If you have an ingrown hair or cyst that's causing discomfort, it's best to see a healthcare provider for safe treatment. Question 4. How can I prevent vaginal lumps and bumps from forming? Prevention involves good hygiene and care of the area. For example, exfoliating can help prevent ingrown hairs, while wearing loose, breathable clothing can reduce friction that causes skin tags. Regular health checkups can also catch any potential issues early. Question 5. Are all vaginal lumps sexually transmitted? No, not all lumps are sexually transmitted. While conditions like genital warts and herpes are linked to STIs, many causes of vaginal lumps like cysts, ingrown hairs, and skin tags have nothing to do with sexual activity. Vaginal lumps and bumps are incredibly common, and most of the time, they're nothing to worry about. However, knowing what causes them and when to seek help can give you peace of mind. If you ever have concerns about a lump, don't hesitate to reach out to a healthcare provider. Early detection and treatment are key to staying healthy and feeling your best. Take charge of your health today. Schedule an appointment with your healthcare provider or visit our website for more information.